Welcome to A Shot in the Arm podcast. We're here in Japan with the Global Listening Project. We've been organising a roundtable to understand and share some initial learnings about how the world has coped coming out of COVID, but particularly what Japan has learned. And our guests today, we're at that roundtable and are here to give us some more information. So first up, Professor Hitoshi Oshitani from Tohoku University. Hitoshi is also a member of the Global Listening Project's International Advisory Board. Professor, it's great to see you here. Thank you so much for welcoming us.
Yeah.
We're also joined by Dr. Rachel Dawson, who is the Global Medical Affairs Lead for COVID at Moderna. Rachel, welcome to A Shot in the Arm podcast.
Thank you. I'm glad to be here.
And last but by no means least is our co-founder and lead of the Global Listening Project, Professor Heidi Larson. Hey, Heidi.
Great to be here on our round the world tour.
I know, right? So we presented initial learnings from what will be our Societal Preparedness Index. What were the top line data we presented?
Well, today with our roundtable here in Tokyo, we looked at the 70 countries where we have done our surveys, and then we took a bit of a deeper dive in what's going on in Japan and in the region. We also looked at G7 countries to get a different slice. Fascinating differences. Japan was really unique in the nature of each country is unique, but this one had some particularly interesting twists and turns.
What a lovely way of setting Hitoshi up. In the roundtable, Hitoshi, you spoke about an emerging sense of what you called tolerance in society in Japan around COVID. And by tolerance, I think we understood the word complacency. Could you talk a bit about that and why that concerns you?
Okay, so in Japan, our number of deaths per population was relatively small compared to the other Western countries. But the number of deaths increased by wave. And initially, we are very, very sensitive to any deaths in the first wave of the pandemic. But it's gradually the tolerance level, they actually increased. And in the most recent wave, in early this year, in 2023, we actually had more deaths, but the people are not that sensitive to the increasing number of deaths. And this is a kind of the concern for us. When the next pandemic occurs, we may not be able to implement strong measures. And people they think that we are done with COVID, and we are okay with COVID, and then the strong measure may not be implemented in the next pandemic. That's my concern.
Could you tell us a bit about your background? Because obviously that anxiety that you have that people are no longer going to be prepared or willing to listen is very important. You are at Tohoku University. What's your specialty? What are you doing there?
I'm a professor of the Department of Virology, but I'm doing both epidemiology and virology for the various infectious diseases, especially the viral respiratory infections. And I've been involved in emerging diseases, including the pandemic, for more than 25 years. I used to work in the WHO Western Pacific Regional Office in Manila, there where the SARS outbreak occurred. And I was also responsible for the response to the highly pathogenic avian influenza and the pandemic. The preparedness was a major issue in the early 2000s, 2005, 6, and there was the growing concern about potential pandemic with the high mortality impact. But after 2009, actual pandemic in 2009 caused by H1N1 virus, which was the milder than expected. And then the level of global concern actually decreased significantly. And then we had the COVID, and which had very large mortality impact. So, and the complacency is the major enemy for us in terms of pandemic preparedness.
Yeah, totally. And I wonder, Rachel, if I could come to you, because overcoming that complacency must be a core part of your work. But there's also something about your background that is very interesting. Hitoshi referred to H1N1, and in the roundtable, Hitoshi, you also spoke about the 1918 flu, which particularly attacked young people. And Rachel, you are a specialist in adolescent health as a physician, yes?
Yes, that's correct.
So tell us a bit about that, and then how that sort of raises your heckles, as it were, for how we address complacency going forward.
Yeah, so as he alluded to, I think that it is a very big threat, the complacency that we see. So we need to continue to remember that just because we are now in a place where we're going from a pandemic to an endemic, that COVID is still a threat. And it is actually causing more hospitalization, severe disease, and death than other respiratory viruses. And so although we are in this endemic state, we cannot slow down in encouraging prevention through vaccination.
I wonder, Heidi, is this sense of complacency, tolerance, something that we're seeing around the world? Is this a surprise to you to hear this?
Not so much of a surprise in the sense that, we see with influenza, for instance, that, there's still a lot of people who die from just the flu every year. And it's really hard to get people motivated because they see enough people living through it that they don't want to take the risk. With COVID, as Rachel mentioned, it's still a far more dangerous virus, and it's still evolving. I mean, all these viruses constantly change, which is why we need new vaccines periodically. But it is a big issue, complacency. And I think also with another aspect of the complacency is really pandemic fatigue. People are tired. It's almost like we've had enough. This couldn't be that bad. We've lived through this. But also, to be fair, what the vaccines really do is keep people out of the hospital, prevent severe disease. And for some particularly younger people, they don't feel like they're the ones really at risk, which is quite different, as Toshi was saying, was each virus targets differently. And that creates sometimes different parts of the population more complacent than others. But globally, the biggest challenge we've had with COVID is the younger ages, 18 to 34, even younger adolescents, who don't feel like it was their problem, that they felt they paid the price for older people's problems. And that's a challenge because actually it was everyone's problem, and we need much more a sense of societal cohesion. And that's one of the wonders in Japan, is this strong sense of, and maybe Professor Hitoshi can speak more to that, this sense of social responsibility, as a word, duty even.
Yeah, because you had mentioned when we were looking at the attitudes, particularly of elders, that there was really extensive vaccination amongst the older population in Japan. And you referred to this idea of harmony and sort of responsibility to each other.
The vaccine coverage, the COVID-19 vaccine coverage is quite high in Japan, and not only in elderly, but also in young people. And many young people were vaccinated because they don't want the infect others. And this kind of the pro-social, the behavior is the one of the characteristic of our culture. And people do not want to infect others. And that's the main reason why even young people were vaccinated. And this may be difficult to do in other countries, but that kind of and also the behavior change was the obvious during early time of the pandemic. The people change the behavior. They don't go for the drinking, for example. And if the government declared the state of emergency type of the declaration, and the people changed the behavior, we did not implement any the measure with the law enforcement power, but it's just a recommendation. But the people that followed the such recommendation.
Rachel, I wonder if I could turn to you. And I mean, you've seen expertise, experience in the US. You're originally from Brazil, and you are here for a little bit of time, a few months or so, to support the Moderna team here. And I just wonder how you react to what Hitoshi has said, because my gut feeling is, oh my gosh, I wish that we had that sense, say in California or say in Ringwood, Hampshire, United Kingdom.
Mm-hmm. No, yes, I agree. Across the globe, we see very different sentiments towards vaccination, and who are we listening to? Who are we asking questions to about whether I should get a vaccine or not? So, in my global role, I've been able to travel through different countries. And in particular, I recall in a COVID flu campaign that was happening in a South American country, and they feel like they really trust their physicians to get in health information. And they decided not to go to their physician for the COVID flu campaign because they did not want one of the vaccines, but they knew they wanted the other one, but their doctor would ask them to get both. So then in the end, they're like, well, I'm just not going to go to the doctor at all, because when they tell me I need both, I'm going to have to say yes. Versus, let's say in the United States where I live, where, you come to the doctor and you tell them what you want, right? I want this vaccine, or I don't want the vaccine. And you can feel very confident about asking those questions and being forthcoming about what you want or what you do not want in your healthcare. So it's just very interesting to see here in Japan how, there's this social responsibility to be vaccinated so you can protect others. Yeah.
Heidi, I really wonder what your sense of this is. I mean, again, I keep thinking, gosh, if only we had this kind of cohesion more globally. But I guess, and this comes to the heart of us being in Japan, to what extent do you think that there are lessons that we are learning here that can be applied in other countries, in other settings? Or do you think that the experience in Japan is pretty unique?
Well, I think what we're seeing is the power of culture, which we talked about earlier, and that we should pay more attention to that. I mean, I've been thinking not only of the Japan-specific issues, which, are obviously where they're great ones, we want to amplify them, but also the kind of things that really matter. For instance, even though the culture has been pro-social, it's interesting. I mean, I remember learning several years ago that people were wearing masks, not in a flu or COVID time, because they didn't want to spread their cough or their cold to other people. And it was very much to protect others, which actually in our global research, we do see that with vaccines. When you ask someone, would you take this to protect yourself? And then ask them, would you take this to protect others? The numbers are always higher globally. In some countries, less different than others, but I think there's a particularly strong sentiment here. It's not true for things like HPV vaccine and certain other vaccines, but that's because that's more of personal vaccine. It's not something that, it's not like a respiratory virus. So I think that also speaks to other things. But I do think the lesson of paying attention and appreciating the cultural differences in different settings is a big learning from COVID. Even within countries that have diverse populations, the importance of paying attention to cultural differences where people did pay attention to those differences, it made a big difference in terms of the success of the program.
Hitoshi, as you reflect on the roundtable that we've had and the initial learnings that we're seeing about the societal preparedness right across the board, what do you think are what's the key advice you would give us? What areas should we be looking at as we build a sort of more comprehensive approach to crisis preparedness, not just pandemics?
The whole of society approach is necessary, and the all crisis, including the pandemic, there is no one size fits all type of the solution, and there is also the vaccine, the contribute to the reduction of the mortality for the COVID-19, but the vaccine cannot solve all the problems.
Yeah.
And we need to have a multiple layer of interventions, not only for the pandemic, but also natural disaster and other things. And so that's the public health infrastructure, clinical infrastructures are also necessary to be prepared for the next crisis. And so there might be no vaccine for the next pandemic. And so we need to consider different scenario. And natural disaster and the pandemic, they occur at the same time. And so the worst case scenario should be considered. And so we need to have a multiple layer of interventions to be prepared for the next crisis.
And meanwhile, of course, COVID has not gone away. And I mean, Rachel, what should we be doing going forward? Because we're in this endemic phase now. We've gone out of the sort of early crisis. Back to this issue of defeating complacency, what should be our strategies?
Mm-hmm. I think that we need to continue to emphasize the burden of disease and remind people that there are still deaths going on today, as we've heard many times, and that COVID is still causing more disease than most respiratory viruses that we see out there. So we need to continue to discuss and talk about the burden and how important that is. And also educating on vaccination and prevention, and answer questions and doubts that individuals might have around the vaccine. Talk about what are the reasons why they may doubt or regret or not want to receive a vaccine. I think those are all important points we need to consider.
Well, I guess we're sort of coming up to the top of the hour, and I mean, Heidi, we will have the learnings of this Social Preparedness Index on our website, which of course is www.global-listening.org. It'll be in the show notes. But what happens next for us here in our collaboration with Japan? What will we do next?
Well, while we do the global analysis and to inform our Social Preparedness Index, we're going to be doing what we're calling a deeper dive, a more focused look at the Tokyo greater metropolitan area, because we want to look at how, in a very localized way, how there are differences. We'll be doing the same in the New York City greater metropolitan area, because cities are crucial, particularly for infectious disease spread. As we've talked about earlier, things went better in some of the rural areas. One, there's still stronger sense of community, and not to neglect rural areas at all, but there are different dynamics in cities that we want to understand. So we'll be back. And actually today's discussions with the very esteemed and helpful comments from the group, and we had someone from technology side, from the infectious diseases. We also had from hearing from different age groups and industry, as well as research, the kinds of questions that will be important to ask, and also how that plays out across ages, across different parts. Local government, that came up as a big issue. But from that, too, we're going to understand much more specific the nature of why people made the decisions they did, and how that might be important also for different kinds of crisis. So really excited about doing that. And we're doing this very much hand in hand with our local Japanese partners. We couldn't do it without that. And that will inform then different types of preparedness efforts and engagement, communications, and very excited about that.
So as a final question, round robin, but Hitoshi, for you first, what's it been like to host a bunch of foreigners coming in and sharing experiences about what we have learned, perhaps initially around the.
It's important to learn lessons from other countries, and it's we have our culture, which has some positive aspect, but also the negative aspect, and we have a very strong peer pressure, and which may create some discrimination of the infected people and so on. So it's a different cultures or the different countries they responded to any crisis differently, and there are some positive and the negative aspect for all the responses, and it's important to have.
That's the world over, though, isn't it? I mean, sort of pointing to the otherness of people who potentially are infected. But Rachel, so you've just arrived basically in Japan, and you've been here. And I was going to ask you, okay, what's been the favorite thing that you've seen or heard so far? But I guess that might be a bit premature, but anything stand out to you?
Yes, actually, one of my Japanese colleagues took me to a lunch at a very traditional Japanese restaurant where we walk in and take our shoes off and sit at a sort of communal table. And that was a really neat experience. And, me trying to eat with chopsticks, which is still a challenge, but I'm getting better at and attempting to do that. So far, it's great.
Well, next time we're on a podcast together, we will just see how your chopstick skills are.
Yes. Yeah, maybe we can do a live experience.
Heidi, you've been to Japan a fair amount, but this time round, anything really stood out to you?
Oh, there's always so many things here. I guess I've just been it's been so interesting because I have been coming back and forth for many years, particularly around the HPV vaccine experience. And it's been striking to me how different the COVID experience was. But what I see in my own experience is how much trust matters. And I feel like I have such friends here in ways that I guess instead of seeing something new so much, it renewed my sense that when people come together and how trust builds and the importance of keeping and renewing and constantly renewing, because that's really important. Trust is not a one-time. And the thing I think with COVID and the different conversations I've had is we need to build on this, because actually Japan did do really well. And how can we build on that and keep that spirit up? Because that pro-social asset that you have, as you said, it may not just be another pandemic. It may be a pandemic and a tsunami at the same time. And we need each other. And I feel like there's it gave me a lot of hope that what's going on, and I guess that was the most important thing to me.
Oh dear, I feel really rather frivolous now when I say one of the highlights for me is actually being in this studio, because I discovered that my favorite Japanese city pop band that the production crew have never heard of, Kirinji, actually recorded an album here some years back. So this has been a real fandom moment for me. So anyway, well, that's it for this episode. Thank you so much to our guests, to Hitoshi, to Rachel, and of course to Heidi. Thank you to our local production team. Thanks to our director and producer back in California, Eric Espera from Newsdoc Media. The Shot in the Arm podcast is a project of the Global Listening Project. And it just remains for me to wish you a great week and a safe week, everyone. Thanks very much.